Hello everyone, my name is Brian Erb, and today I'm going to be giving a presentation on fraud and abuse in healthcare and how it impacts our nation's system of healthcare. So some of our learning objectives for today will include the financial consequences of fraud and abuse in healthcare, some examples of what it might look like out in the real world. We will also be looking into how healthcare fraud is a breach of the American Nurses Association's Code of Ethics, which nurses are held by, and which ethical principles are violated in healthcare fraud. Lastly, we will discuss the nurse's role in keeping vigilant for this form of unethical behavior and what they might do if they encounter it in the real world. Okay, so for this week's assignment, I chose the topic of occupational fraud and abuse, including conflicts of interest and healthcare fraud, because this is a hugely wasteful issue that only seems to be getting worse in our nation. This is defined as intentional deception or misrepresentation that an individual makes knowing it to be false and that it could be in some form unauthorized benefit to themselves or others, basically. Healthcare fraud is a serious issue because it can place patients' lives in danger, and it also increases the strain on our already overburdened system of healthcare. This affects every working American by increasing the tax burden on them through Medicare and Medicaid services, as well as increased premiums for private insurance and other healthcare plans. It can also, in some cases, place the patient's lives at risk through the provision of medically unnecessary treatments or surgeries sometimes, which, come with many risks of their own. So looking deeper into this issue, trying to dig around some and find hard data or statistical facts on it, I was able to discover that there is really no uniform way to measure the exact cost medical fraud has on our nation. But some researchers estimate that around 3 to 10% of total healthcare expenditures in the US can be attributed to fraud. The total cost of healthcare expenditures in the US in 2021 alone was measured at $4.3 trillion, which would mean that up to $430 billion was potentially spent on fraudulent activities in that year alone. Healthcare is already the largest area of spending in the US by far, exceeding that seen in other developed nations. Yet we continue to lag far behind in other nations as far as health outcomes go. There's no doubt that this massive waste of healthcare dollars is channeled to greedy businesses performing fraudulent activities, and this is one of the main reasons why outcomes is lagging so far behind other nations. So, due to its intentionally deceptive nature, healthcare fraud is hard to accurately measure. However, according to the US Department of Justice, more than $1.4 billion were lost from the 138 charged defendants that we know of. A total of 42 licensed medical providers were also caught and charged in that year alone. On the other chart, we can compare and contrast the cost of Medicare fraud in the US as compared to other national expenditures. As you can see, the cost of Medicare fraud far exceeded the budgets of other extremely costly programs in the US, including NASA and the Department of Homeland Security. It is also important to keep in mind that this is the only fraudulent activity that we know of alone, and in just Medicare alone. Healthcare fraud can take the shape of many forms. Our textbook lays out just a few of the ways the FBI has caught up offenders of fraud and abuse. One of the most concerning and likely highest costing forms of fraud is the provision of medically unnecessary services. This can be instances such as a dentist taking additional x-rays of healthy teeth simply to use up your insurance benefits, or in more extreme cases, providing an unnecessary surgical procedure, such as a total knee replacement, on an otherwise healthy and functional joint. Surgical procedures are a form of treatment where risk must be weighed against benefits due to the higher likelihood of an adverse event from happening. So to provide this form of treatment without any solid medical necessity is deeply unethical. Some businesses also committed fraud by billing patients for treatments that were never provided, or billing for a patient for a more expensive procedure when a sub-quality one was actually provided. Our textbook lays out an example that I thought was pretty nice. They used the example of billing a patient for like an automated wheelchair and only providing a patient with a manual movement sort of wheelchair instead. Other businesses attempt to receive extra reimbursements by breaking up patient bills into smaller, separate procedures, which prevents the patient from saving by otherwise having these procedures bundled together. Lastly, such as the case seen in our discussion post this week, some businesses or individuals receive lavish compensations for unethically arranging business deals. This can look like a drug manufacturer providing a financial incentive or kickback for a CEO in return for the CEO utilizing their products at their facility. So healthcare fraud can potentially violate multiple provisions of the American Nurses Association Code of Ethics. However, I felt it was most notably that it violated the provision 4 of the Standards of Care. This provision deals with what is expected as ethical behavior from the nurse, which would include qualities such as trustworthiness, accountability, responsibility, and the position of authority. Engaging in fraudulent healthcare practices violates each one of these principles, which are laid out in this provision alone. In addition, some fraudulent activities may place the patient's health and subsequently their life at risk, which violates the nurse's obligation to provide and promote optimal care. So, because healthcare fraud can take the shape of many forms, it can potentially violate all the ethical principles that nurses are held by. This is because this sort of unethical behavior can be just about any sort of thing you could think of. I mean, just faking whatever you want to do, basically. A physician violates the patient's right of autonomy when they purposefully mislead and provide false information to make the patient believe that they need to undergo an expensive and often risky procedure when it is actually unnecessary. In the same way, the healthcare team is also violating the ethical principle of veracity if they knowingly engage in this behavior with the provider, as they are not providing accurate information and are in some cases simply lying. Lastly, the principle of non-malfeasance is possibly the most important principle healthcare workers are entrusted to follow, is violated in this case. This is because lying to the patient so that they may receive more money for unnecessary medical treatments can place the patient at risk due to the inherent risk of some of the procedures that they undergo, such as surgeries or invasive procedures, which are not always 100% safe. This is a complete violation of so many ethical principles, but the most serious one is knowingly placing the patient's health or their life at risk for simple greed. So, admittedly, it can be a huge challenge to report fraud when it is encountered in your workplace. Depending on the type of fraud witnessed and how deeply embedded it is in the facility's practice and who is responsible for committing it, can all greatly affect how easy or hard it can be to report it. For instance, if the physician is knowingly committing healthcare fraud and the nurse decides to report them for doing so, this may place the nurse at risk. Physicians, after all, hold great power over nurses and have been known to retaliate against them for simply ignoring them, which may be in the form of having them demoted, having action taken against their licenses, or terminating them from their job, among many other potential punitive measures. Nurses must be extremely careful when going about how they choose to report fraud in their healthcare setting, as there is often corrupt systems already in place enabling the unethical behaviors to go on. In the state of Texas, nurses can report suspected cases of fraud or abuse to the state Texas Auditor's Office, which presides over healthcare services and how they're delivered in this state. Unfortunately, healthcare fraud is a serious issue in our nation that only seems to be growing. This is due to multiple factors, such as the move to a more complex and digitalized form of healthcare delivery and the expansion of Medicare and Medicaid services, which holds the promise of greater reimbursements to providers and facilities. Too many healthcare facilities are all too willing to exploit these vital services for financial gain, holding this type of funding from our most vulnerable populations who are in the greatest need of receiving these services. This speaks of deeply rooted unethical values and behaviors that I believe needs to be a major focus moving forward in our nation's system of healthcare. We can't fix what's broken if we don't choose to look at the ugly side of what we do. So, putting an end to healthcare fraud is probably one of the greatest challenges that we're going to see moving forward in the 21st century. Well, that's my PowerPoint, everybody. Thank you for watching. I hope it was enjoyable, or at least informative. Y'all have a great day. Be safe out there. Keep studying.